me blood when I'm in need. She says my circulating volume ain't good after surgery. Yeah, I got a trauma or a hemorrhage, and I need some RBCs. Yeah, I got anemia. I need some replacement therapy, 'cause I need some clotting factors, albumin and platelets all in me.
Rh factor is an antigenic substance in the B erythrocytes. If you have the Rh factor, you are Rh positive. If you don't have it, you are Rh negative. Blood must also be matched for the Rh factor along with the ABO grouping. People with negative Rh factors can only receive negative blood. People with positive Rh factors can receive both negative and positive blood.
You should check my type. Check the orders to ensure that they're right.
Trying to save your life. We give transfusions every day and every night.
Make sure to check the site to make my patient comfy so phlebitis ain't a fright.
I'm just giving erythrocytes. I'm cautious of my actions 'cause I wanna do it right.
Share it how I like.
Hang it every night.
Quick start the line.
Bring them back to life.
2 nurses check it twice, and they got a sign.
Put the date and time.
Don't forget those vital signs.
She says, what's my type?
I say I am AB type.
Beware of those reactions.
It could be anaphylactic.
If we see a blood reaction,
Stop the transfusion interaction.
this could be cause of infection.
So you better get to inspecting. You should check my type. Check the orders to ensure that they're right.
Trying to save your life. We give transfusions every day and every night.
Make sure to check the site to make my patient comfy so phlebitis ain't a fright.
I'm just giving erythrocytes. I'm cautious of my actions 'cause I wanna do it right.
Stay with the patient during the first 15 minutes, the time when a reaction is most likely to occur. Continue to monitor the patient and obtain vital signs periodically during the transfusion as directed by agency policy.
An acute hemolytic reaction can occur during a blood transfusion. Some clinical manifestations include chills, fever, low back pain, flushing, tachycardia, and tachypnea. Some management techniques include to stop the transfusion immediately, treat shock if present, maintain blood pressure with intravenous colloid solutions, and do not transfuse additional red blood cell containing components until transfusion service has provided newly cross-matched units.
The most common reaction is a febrile non-hemolytic reaction. Some clinical manifestations are sudden chills and fever, or a rise in temperature of greater than 1 degree Celsius, headache, flushing, anxiety, and muscle pain. The management is give antipyretics as prescribed, avoid aspirin in patients with thrombocytopenia, and do not restart the transfusion.
Mild allergic reactions may occur during blood transfusions. Clinical manifestations include flushing, itching, and hives. Give antihistamines as directed. If symptoms are mild and transient, transfusion may be restarted slowly. Do not restart transfusion if fever or pulmonary symptoms develop.
An anaphylactic reaction will present with anxiety, urticaria, wheezing, progressing to cyanosis, shock, and possible cardiac arrest. If this occurs, initiate CPR if indicated and have epinephrine ready for injection.
Circulatory overload may occur and present with cough, dyspnea, pulmonary congestion, headache, hypertension, tachycardia, and distended neck veins. Place patient upright with feet in dependent position. Administer prescribed diuretics, oxygen, and morphine. Phlebotomy may be indicated.
Sepsis can also occur. Some clinical manifestations of sepsis would be rapid onset of chills, high fever, vomiting, diarrhea, and marked hypotension and shock. If this occurs, obtain culture of patient's blood and send bag with remaining blood to transfusion service for further study. Treat septicemia as directed, antibiotics, IV fluids, vasopressors, and steroids.